So to help us shed some more light about what this whole thing is about is Mr. Malto Ablo. He's the Director at the Social Protection and Ministry of Gender for Children and Social Protection. Good morning, sir.
Good morning.
How are you doing?
Fine, thank you.
Right. A happy new year to you.
And many happy returns to you.
Right. So what is this whole e-card about? Can you explain in detail for us?
Yeah, thank you. Basically, the e-card is supposed to provide a range of services for the elderly in our society. The issue is those who are aged or who are aging 65 years and above have contributed so much to the development of our society. They have contributed their quota to the social and economic development of this country. And when they get to these ages, it is time for us also, those of us who are younger, to support them and to give back to them what they have provided for society.
Okay.
So we have, in collaboration with our key stakeholders, discuss ways and means of supporting them. Basically, we have a national aging policy. And as part of the implementation of the policy, there are a range of services that we need to provide for the elderly. And one of them is the Eban card. And this is supposed to help them, one, as has been rightly said, board the metro buses and pay just half the price.
So it's just for metro buses?
It's not only the metro bus.
Okay.
For the transport, for the initial stage, we are working with the Metro Mass Transit, and they have agreed to charge half the price for the elderly.
Okay, so it doesn't apply to taxis.
The card is also to enable them get priority access in many public services. Let me give an example of the hospitals. You go to the hospital, see the elderly, you also join the queue just as the young ones. You see sometimes they are under so much stress, but they must go through the queue and the stress they go through before seeing the doctor. Now, they are supposed to be given priority. Once they have this card and it is shown at the hospital, they are given priority to have access to seeing the doctor, going to the laboratory, taking their medication, etc., and then move away. In the same vein, when they go to the banks, for instance, they also have to join a queue. So once you are holding this card and you appear at the bank, you are given a priority access to have access to whatever transaction you want to make, and they go back. But in terms of the transport, we have just initiated discussions with the GPRT. Of course, we are working through the TUC. You know, the TUC is the mother organization of the GPRTU. It's one of the affiliates of GPRTU. And there are so many members of the GPRT who also retire and become elderly. Okay, so we are having discussions with them to see how best they can also support this noble initiative to give back to our elderly what they have contributed to in building.
Okay, so for now it only applies to the buses.
For now it applies to the buses, but we are also working on the GPRT to see how best
you can
this arrangement can.
Okay.
Yeah, and they are open to the discussions anyway.
So who is eligible? People over 65
years and above.
Okay, and what is the process for acquiring this card?
The process is that we register them. We use means of verification, ID cards, date of birth, etc., to do a special registration for them and issue the card instantly. We have engaged a service provider, Margins, who have designed this card, and then they collect data from the beneficiaries and then process and then issue the card immediately.
Okay. Do they have to pay anything to get?
No, they don't have to pay anything.
It's absolutely free.
It's absolutely free.
Okay,
and but it is costly. Okay. I must say, initially we have had support from the UNFPA, the United Nations Population Fund, to undertake this. It costs quite some amount of money. Though these are elderly, when they are coming to register, they come to a particular point, they assemble there, and they stay there because you must wait for your turn to come. And we, knowing how we need to treat them, we make provisions. For instance, wherever we have a registration center, we put up canopies there, we hire chairs and put them to sit down comfortably. We give them some water and then some snack so that they feel comfortable and relaxed until they register, take their card, and they go home.
Because
and even in some cases where they cannot move there, we have to arrange transport for them to come and do the registration, and then they go back to their various homes. So this is what we do.
Where are these registration points?
It's based on the communities. For instance, we're told we had it in Choko, we had it in Ungwa, we had it in La, Shaman, and Nima. Okay. So we work with the district assembly of the communities and then get a place which is very convenient to get all these people together to undertake the
so it
process.
started already. It's been
Yeah,
implemented.
It's so we've so far, as said in the news, we have about 1,002 registered in these localities. That is just the beginning.
Okay, and also for we saw in the report that they said they would only have to pay half price. Is this to any destination at all? No matter where you're going, you pay.
No matter
half
where.
the
Once
fare.
you enter the Metro Mass Transit bus, you pay just half the price to whatever destination that you are going.
Okay, and is there a limit to how far they can go, the distance, or is just anywhere at all in the country you're going?
Wherever you are going, once you enter the Metro bus, you pay half the price to your destination.
Okay. Are there any plans to bring on private commercial vehicles?
Yeah, that's what we're talking about with the GPRTU. We're having discussions with them. Like I said, we're using the TUC. It's one of our partners, and we see how best they can, because as beneficiaries, their members also retire and become elderly, and they also enjoy these services. So they are open to the discussion. We'll see how far they can also come to support.
People have also expressed concern about the sustainability of this project. What would you say to these people?
I must say it's sustainable in the sense that it is an initiative that many people have applauded, both the young and the old. And therefore, we are hopeful that we will get the needed support to get it done. For instance, what we are thinking of doing now, because the demand is coming up, people are demanding this service. So we'll be going to the various regions and the various districts. But as I said earlier on, it costs us some money to get this thing done.
Exactly.
And we as a ministry will not be able to get all the money to, for instance, bring them together for the service. We will be able to provide the card.
The initial card.
The initial, that's getting the service provider, paying them for their services to produce a card.
Okay.
But other costs, like for instance, if you need to bring them from their home to a registration center to put the canopies, to provide them with chairs and some snack and water to make them comfortable to go through the exercise, we'll be working with the district assemblies. We have, as a ministry, been working with the local government service secretariat for social protection in general, and one of the components is to work with them also through them to the assemblies, so the assemblies can also provide some kind of support. Maybe the assemblies want
some support from government.
We are yet from what the assemblies. Definitely, assemblies is a government institution, so that's what
you're
we're
yet to get the funds.
We've started. The government has provided support in doing all this, and I also said the UNFPA have also funded it. But going forward, if we talk about the issue of sustainability, we know government cannot do it all alone.
I was just about to go there.
All alone. Therefore, we would also make requests from these assemblies through the local government service secretariat. So at least probably they would provide the environment where the registration will take place, the canopies and the chairs and maybe transport and some snack and water for the elderly. So once they come there, they will be providing the registration services. So it's going to be like, maybe we'll look at it as a form of kind of a demand-driven type, so that once the assembly is ready and prepared to organize them, mobilize them, then we bring in the registration people to register them and then issue the card. And we'll also be appealing to the general public, the private sector, the civil society to also contribute. Let's not forget that in some private sector organizations, we have people who have worked there and who have also retired and have got to this age and they become elderly and senior citizens in this country. So we think that they have also contributed a lot to the development of this private sector, and therefore there's a need for them also to appreciate what these people have done and also come along to come, because there's a goodwill, and we are very hopeful that we're going to get the needed support.
Exactly. I believe that's the major concern for the people who feel like it won't be or it can't be sustained is the funds, the source of funds, because we are all very much aware by experience how government sometimes can delay with releasing some of these funds. So if it's not forthcoming, then what happens? Yeah,
well, looking at assembly, for instance, I said the component of we providing the registration, government will be able to do that with support from government and or development partners. Will be able to do that. Okay, but the other aspect of the cost is what I'm saying. The assemblies will also be ready to support, because the point is that for the assemblies, most of them also generate revenue. Okay, some IGM, internal generated revenue, so they should be able to support. If an assembly wants this to be in their locality and to support the elderly, to show that they care for the elderly, definitely we are very sure that they are coming on board for us to get this thing done and then make our the elderly more comfortable.
Yeah. Right. So at the moment, do you have registration points in all regions in the country?
Not yet. We are working on all those ones.
So eventually,
we just want to launch. We have just launched it, and then with the next phases, as part of our work plan for this year, we'll be going to the various regions and then the districts to get people registered to benefit.
This is just
but one of the initiatives, for the elderly.
So we
have already last year initiated the registration, the biometric registration with the National Health Insurance. So while they were doing biometric registration, we worked with them. We have registered a number of them. We have done it in Greater Accra, and that's one of the districts in the central region. And we have registered over 3,002 who are having the NHIS biometric, card. Okay, that is just another one. And then also, we're finalizing work on we are working on a bill to come up with a law on aging. And we have set up an advisory council which comprises key stakeholders who are now currently working to develop the bill.
Okay, what kind of law are you looking at for the aging?
We are looking at some essential services or some essential things that the elderly must have, as a right. Okay, so we are looking at that. So we are now looking at this. So we've just at the initial stages of developing the bill. So I won't be able to tell you exactly what we have in.
All right. Finally, we also heard the minister talk about bringing in special buses. What kind of buses is she talking about?
Yes, the Metro Mass Transit are bringing in new buses next year, and those buses that can have the electronic gadget to be reading the cards and other things, just like we have in some developed countries where you can have a card instead of the conductors collecting money, etc. You use these electronic gadgets to facilitate boarding of these vehicles.
Do you think some of our agents will be able to use
definitely our card is has been
user friendly.
To do that. Yeah, okay. So. Yeah, because that's why we worked with them from the beginning. We did not just work in isolation. We were aware of what we had discussions with them. They told us what they were doing and how can we make this card user friendly for the elderly, and also to be able to use it on the services that they're going to provide from next month. So
okay, will there also be special facilities on board the buses for the aged? Maybe special seats, maybe even easy access to board the bus and so on.
Yeah, if you listen carefully, the Honourable Minister on that day, and then also the representative of the I think the Ghana Association of the retired persons also mentioned this issue to the Metro Mass Transit, just as we have in developed countries and other developing countries, where the bus will be such that AC access will be something that so we have had this discussion with the Metro Mass, and they also taken all this into consideration. The hope is that once these new buses begin to come in, some of these special features will be there. And then also they've also agreed to look at on board the buses, probably some special seats that will be allocated for the elderly, not only the elderly as well as the physically challenged. Okay. So once they get on board these buses, these areas are reserved for them, just as we have in other developed countries. But the other aspect is we Ghanaians being aware, especially the general public being aware of the rise of these elderly persons, so that if once you're on board and then
an elderly
assuming those chairs are unoccupied and a younger person, once they come on board, we freely give out this courtesies. The respect we have for the elderly in our homes should be expected.
Buses?
Well, I wouldn't be able to say how soon. That is not in our domain to say. It's basically with the Metro Mass Transit. They are working on the side.
But for the meantime, we'll make do with the buses that are available.
That are available. But they've assured us the new buses that will come will have some of these features that will facilitate the use by the elderly. Yeah.
Right. Thank you so much for your time this morning.
Mr.
Mauto Ablo is the Director of Social Protection at the Ministry of Gender, Children and Social Protection, and he's been here this morning talking to us about the e-card that is available for the aged. People over 65 years old, and it's just about to be launched, so stay tuned for that, and you can access it when it's launched.